most CPC students lose 4 marks easily in the exam. Not because questions are difficult, but because they don't understand the concepts in anesthesia. So if you understand the concepts properly, you can easily get 4 marks. So we will start the anesthesia series. So anesthesia codes range from 0000 to 01990. So these are the important concepts in anesthesia. We will see one by one. First, we will see what is anesthesia and its types. So anesthesia is a medical procedure which is used to prevent pain and discomfort during a surgical, diagnostic or therapeutic procedure. So this works by blocking nerve signals to the brain, which also leads to loss of sensation, loss of pain or loss of consciousness. Next one, we will see the types of anesthesia. First one is general anesthesia. So here the patient is completely unconscious. There will not be any pain, no memory about what the procedure is done. Here the airway support is usually required. Since the patient's body is unconscious, there will be breathing difficulty. So oxygen masks will be used. Next one is regional anesthesia. So here only a specific region of body is anesthetized. So the patient may be awake or lightly sedated. There are two types, epidural and spinal anesthesia. So spinal anesthesia is injected into subarachnoid space. So this is a rapid onset. Epidural anesthesia. So epidural anesthesia is given in the epidural space and it is a slower onset. Can be continuous one. Commonly this is used for labor and delivery, then for post-operative pain management. Next is local anesthesia. So local anesthesia, in the local anesthesia, the injection is given to numb a small region. Here the patient will be fully conscious. For example, like for suturing a wound or for any dental procedures, they use this local anesthesia. Next one is sedation or monitored anesthesia, CARMAC anesthesia. So here the sedation is administered to reduce patient's anxiety, discomfort and awareness while allowing the patient to remain responsive, and since the patient is conscious, they will be able to breathe on their own. So here the oxygen mask is not used. So these are the types of anesthesias. Okay. Next one is inclusive and exclusive procedure. So in the anesthesia series, we should know where to code the anesthesia's codes. Okay, so inclusive is already included in the anesthesia code range. Okay, so in our book, okay, CPC book, this paragraph is there. Okay, so these services include usual preoperative and postoperative visit, anesthesia care during the procedure, administration of fluid and or blood, and usual monitoring services. So like ECG, temperature, blood pressure, oximetry, capnography and mass spectrometry. So these procedures are included when the anesthesiologist is doing these procedures. Before the surgery, we don't need to code extra for these procedures. That is inclusive. Whereas exclusive service, so exclusive service is catheter placement, like intra-atrial catheter placement, central venous catheter placement and swan gauze catheter placement. So intra-atrial, into the artery. So before the surgery, if the anesthesiologist is placing these catheters and sending the patient to a surgery, that time these catheter placement has to be coded.